Hi, my name is Walter Saunders, and I live in Reno, Nevada, originally born and raised in Boston, Massachusetts. Um, Currently doing the clinical track MSW program here at University of New England. I chose to take the narrative therapy partly because I was exposed to it early when we were going over, in one of our classes, we were going over the various therapeutic modalities that exist out there. And it was suggested, instead of looking at an old form of eclectic forms of engagement, that we pick three or four modalities in which we could become proficient and be able to be more effective and help our clients. And that's when some of the postmodern approaches, such as solutions focused brief therapy, focused brief family therapy, and narrative therapy, appeared on my radar. And I was super interested in narrative therapy, in just the idea of removing that power differential and the clinician not being the expert but honoring that the client knows their story and knows which challenges that they currently face and would be primarily responsible for creating their own solutions and implementing those into their daily lives. That seems super interesting to me. And as well as yeah, I work in the behavioral health field, and narrative therapy has been shown extremely effective, especially when we're dealing with schizophrenia, and that a vast majority of these clients will have to be readmitted in future hospitalizations within several years. Narrative therapy is actually one of the premier modalities, which actually reduces this number significantly. And it also has a cross useful application with substance use disorders, with eating disorders, and many other disorders, trauma. So I find it very versatile from what I've been reading on it, and I want to add it to my toolbox, potentially with another cognitive behavior modality. I'm not quite sure if I'm more interested in CBT or ACT, and then I am trained in solutions focused, and narrative therapy seems to be a good fit for that. So that's the reason I'm taking this class, and I look really forward to learning more about narrative therapy, and then hopefully begin to practice it during my field placement and move on to certifications with it. I'm super sensitive about doing no harm to my clients, and I want to know that I'm providing the best services that I can for them. And so future trainings to shore things up of what I learned in this foundation class is also super important to me. I currently live in the West Coast time zone, and I look forward to engaging with all my fellow classmates. Thanks, and have a good weekend.